On August 10th, I launched the largest housing assistance program in the nation in response to the COVID-19 pandemic, dedicating our $300 million to help households pay their rent and their mortgages through this financial difficulty. To date, we've awarded $182 million in assistance to support 36,400 renters suffering financial hardship from the pandemic who are unable to make their monthly payments. That's $5,000 per renter, tens of thousands of times over. This funding is sent directly to landlords to pay the rent that's owed. In addition, 4,300 homeowners who lost a job or saw their income decline due to the COVID-19 pandemic have been approved for $36 million in emergency mortgage funds to help stave off foreclosure, with $30 million already delivered to service providers around the state. By the end of this year, we will have assisted 40,000 renters and landlords with $200 million in rent payments and 10,000 homeowners with $100 million for their mortgage payments. Even with all of that positive impact, people are still hurting financially from this pandemic. The need is enormous for landlords, for renters, and for home mortgage holders alike. Both the rental and mortgage assistance programs were oversubscribed 2-to-1, and that's not even counting people in need who might never have applied at all. The people, businesses, landlords, renters, workers, states, local governments, and entrepreneurs of this country are in deep, profound pain, and we need new congressional stimulus for people in this country as soon as possible. But because we can't just wait around for the Republicans in the U.S. Senate to take action, I'll also be extending the moratorium on evictions for an additional 30 days. It's the right thing to do to protect our most vulnerable residents. But landlords and property owners are a crucial part of Illinois' housing cycle, just as much as renters, and they deserve protection too. So with input from smaller landlords and property owners, this new moratorium will ensure that the rents are paid by tenants who may have been taking advantage of the eviction moratorium, but who are in fact able to make their monthly rent payments. In line with the CDC eviction ban, only renters who have earned no more than $99,000 in annual income or $198,000 as joint filers for this calendar year are covered under this extension. Renters unable to pay will be required to submit a declaration form to their landlord certifying that they are unable to pay their rent due to the substantial loss of income or an increase in out-of-pocket expenses stemming from the pandemic. This form will be available on the Illinois Housing Development Authority website for easy access. Just visit that website at ihda.org. This new order also clarifies that enforcement of pre-pandemic eviction orders can indeed move forward if there are serious health or safety concerns. We extend this protection for housing stability as we ask Illinoisans in every part of the state to stay home as much as possible, because the situation we face now is increasingly dangerous for healthcare workers and hospital systems, especially in every part of our state. More Illinoisans are in the hospital battling COVID-19 now than we saw at our highest average in the spring. And increasingly, we have regions at risk for potential ICU bed shortages and staffing shortages as our case rates continue to rise. As our positivity grows, so does demand for testing. Today, we've reached a new high in our testing rate with 106,540 tests returned in the last 24 hours. Our 7-day testing average has now surpassed 93,000 tests per day, more than 10,000 higher than the next best testing state and more than 35,000 higher than the next best testing state in the Midwest. That's good news, and we're continuing to build on that as our capacity allows. Find the site nearest you to get tested at our website at dph.illinois.gov/testing. And check back regularly because we offer mobile sites in new locations all the time to meet local need. And remember, these tests are free and fast and available to anyone who shows up, though some of our most visited community-based testing sites are hitting capacity before the end of their normal operating hours, so come early if you can. Please use our testing resources. The earlier you test, the more likely you can limit the spread of the virus to your family, friends, and coworkers. But it's not enough to test alone. So let's wear our masks, avoid gatherings, and follow public health mitigations. In addition to the health benefits to you, you'll be helping protect our heroic healthcare workers. Remember, they're now working extremely long hours like they did last spring, actively saving lives on the front lines of this pandemic. Preventing the spread of COVID helps keep our healthcare workers healthy. And in the midst of this COVID storm, protecting nurses and doctors may mean the life of someone you care about will be saved, maybe even yours. Thank you, and with that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike.
Good afternoon and happy Friday the 13th. As we head into the weekend, I want to issue a plea for people to stay home as much as possible. I know on Fridays, TGIF, people are thinking about the weekend, you want to get together with friends and you want to get out and you want to do things. But the truth remains that the virus is running rampant through our communities and throughout our whole state and throughout neighboring states, the entire country. And the more people go out and move about and are in contact with others, the greater the potential of spread of this virus and the longer this pandemic will last. If we want to be able to go out to eat, to finally have that wedding that's been postponed since the spring, to visit family and friends, we need to stay home now to be able to achieve that later. And the only way we can begin to get back to normal is to reverse the trend, to decrease the number of people getting infected every day, to decrease the number of individuals getting into the hospital, to decrease the number of deaths. And to do this, we just have to decrease the opportunity of the virus to spread in the first place. I know there's COVID fatigue, but we have to be on guard against complacency. It's easy to want to fall back into our old ways and give up on this virus. Getting together with coworkers on breaks for lunch, not maintaining distance, going out for breaks outside without distance, without masks. These type of behaviors is what led to a recent outbreak at a long-term care facility. And in this facility, we have identified over 160 new cases because of some of that complacency and fatigue. Please know that this virus can spread quickly and it's gaining on us and getting ahead of us, especially in long-term care facilities where we have our most vulnerable individuals. This can happen anywhere. So if you've been vigilant and want to loosen up, please, now is not the time. We can continue to make progress, but we all have to stay doing these things that are so essential. This is an invisible enemy, but has very visible consequences that are palpable. And if we let our guard down, we will let the enemy take us over. Please continue to take all the precautions so that we can eventually win this war, and sooner rather than later. As the governor mentioned, in the last 24 hours, more than 106,000 tests were resulted, which is an all-time high for us, for a total of more than 8.8 million tests since this pandemic began. Unfortunately, 5,362 individuals are reported to be in the hospital with COVID-19, and of those, 990 patients were on ventilators, and 400 990 were in the ICU and 488 were on ventilators. Again, since passing that 5,000 mark, we've been increasing every day, and these are all-time highs, breaking any numbers that we saw in wave 1. Since yesterday, 15,415 new cases, new individuals in Illinois that were not previously diagnosed with COVID-19 have been reported, for a total of 551,957 cases. We have received report of 27 additional deaths in the past 24 hours, but I have to put an asterisk by that 27. There were some data systems that connect with each other that experienced a delay, and that delay has resulted in information for the last 24 hours not being complete. And so I want to say that in advance, because tomorrow we will have additional numbers from today plus tomorrow's totals. Each of our individual actions will determine our path going forward. I say that we are all authors, that we have the pen with which to write the next chapter. And that can be a chapter of further gloom and doom, or it can be a chapter where we actually turn this around. Remember that the more we go out, the more we get together, the more we travel, the more events we attend, the longer this pandemic will last, and the gloomier that next chapter will be. Please, Governor Pritzker talked about the heroes on the front line. We all have the chance to be a hero. We all can be a part of saving lives by just wearing our mask, watching our distance, and washing our hands. And please remember, your mask needs to cover both your nose and your mouth. I know a lot of masks being worn under the nose, or even under the chin. That's obviously not going to be beneficial. So thank you, and now I will repeat the comments in Spanish. Buenas tardes a todos. A medida que nos acercamos al fin de semana, quiero pedir a la gente que se quede en casa cuando sea posible. Sé que los viernes y el fin de semana queremos reunirnos con nuestros amigos y salir y hacer otras cosas. Pero el virus se está extendiendo por todo Illinois y los estados vecinos. Cuando más personas salgan y estén en contacto con otras personas, el potencial de propagación del virus sube y más durará esta pandemia. Si queremos salir a comer, planear la boda que tenía que posponer este verano y visitar a familia y amigos, tenemos que quedarnos en casa lo más posible. La única forma en que podemos comenzar a volver a la normalidad es revertir el curso en que estamos. El número de casos, el número de gente que están en el hospital y el número de muertes tienen que bajar. Para hacer eso, tenemos que disminuir la posibilidad de que el virus se propague. Desde ayer se han reportado 15,415 nuevos casos de COVID-19. Para un total de más de 551,000 casos en Illinois. Desafortunadamente, estamos reportando otras 27 muertes para un total de 10,500 vidas perdidas. 5,372 personas pasaron la noche en el hospital con COVID-19 y de ellos 990 personas están en la unidad de cuidados intensivos y 488 pacientes estaban en ventiladores. En las últimas 24 horas se han informado más de 106,000 pruebas fueron hechas para un total de más de 8.8 millones de pruebas aquí en Illinois. Cada una de nuestras acciones determinará nuestro camino a seguir adelante. Lo más que salimos, más nos juntamos con familiares y amigos, más viajamos y vamos a eventos, más durará esta pandemia. Por favor, piensen en sus vecinas, en sus vecinos, la gente más vulnerable, y tú mismo, porque solo no podemos hacerlo, tenemos que hacerlo juntos. Muchísimas gracias y recuerde los 3 M's, usa tu máscara, mantenga su distancia y lávese las manos. Muchísimas gracias. And with that, I will turn it over to my colleague and friend, Kristen Faust.
Thank you, Dr. Ezike. Perhaps my remarks will be a bit of a bright spot on this Friday the 13th. On behalf of the board and staff of the Illinois Housing Development Authority, thank you, Governor J.B. Pritzker, and thank you to the General Assembly for creating the nation's largest emergency housing relief program. Thank you for highlighting the importance of stable housing to curb the spread of COVID-19 and for giving IDA the opportunity to administer this program. We embraced the opportunity wholeheartedly. We knew there was no time to waste. We wanted to provide aid quickly to as many people as possible throughout the state, but we had to design the program entirely from scratch. Governor Pritzker, you signed the bill authorizing these funds on June 10th. And by August 10th, just 2 months later, we had the application portal open. And on Tuesday of this week, just 90 days later, we have reached our initial goal of approving 30,000 rental applications. You heard the governor, $182 million have already been approved. $135 million of that is already on the street, and the remainder will be out by next Friday. This has been a Herculean effort by the IDA staff, and I could not be more proud of their efforts and the whole team, the countless nights and weekends getting these programs off the ground, all while working from home. IDA staff is driven by their belief in public service and their desire to help. Their enthusiasm, operational excellence, and dedication is phenomenal. But it took much more than the IDA team to make this program a success. We reached out to 62 unique housing counseling, legal services, and community-based organizations across the state and asked if they would help us. They rose to the challenge unhesitatingly. They got the word out to hard-to-reach populations, assisted renters and landlords with the application, answered questions, provided aid in 16 different languages, and were able to help those without the technology to apply. They helped us to ensure our program is equitable and inclusive, a program created to help as many Illinoisans in need as possible. Thank you, community partners. We couldn't do this without you. And there's another group I want to acknowledge, the tenants and the landlords who are weathering this COVID storm, who are doing their best to live up to their responsibilities, but who find themselves with not enough income to pay their rent, or in the landlord's case, no rent to pay their bills. Governor Pritzker has been undaunting in his efforts to provide guidance and aid to the people of Illinois. These programs would not have happened without his advocacy. And these housing relief programs are giant steps forward, and we're proud of our work serving families across the state of Illinois. But we know that this first round of funds is not enough. We are advocating and ask you to join with us in reaching out to the Illinois congressional delegation and the rest of the United States Congress about how important it is to pass legislation to bring additional support to Illinois renters and homeowners and landlords as we enter these winter months. Help us fight for round 2 of stimulus, and we promise to keep improving on our program delivery with your input, which you can give us at communications@ida.org. I'd now like to welcome Governor Pritzker back up to the podium for questions from the press.
Thank you very much. And before I take questions, I just want to say that we have a lot to be proud of in the state of Illinois. And one thing that I think people should be very proud of is the people who work at our Illinois Housing Development Authority. You can see by the enthusiasm of Kristen that she gets at everything right away and works hard to get it to completion. And it's the people that work for her who make all of that happen under her leadership. And I'm very proud of the work that they've done. There's so much more help that we need to offer to people who are renters and homeowners who are suffering during this time. But I think you should all know that IDA is standing with you and working very hard on your behalf. So with that, I'll be happy to take questions from
Governor,
Chris.
a question for you about the number of cases today. It's a stunning number,
It is.
15,415.
It is.
Excluding data anomalies in other states, this is apparently the biggest single-day increase any state in the country has seen.
Yeah.
Tripling in the last month. We have viewers who are concerned and upset. The question I have for you is this. Starting last Friday, you began combining confirmed cases and probable cases. Can you unpack for us the 15,000 figure of how many are confirmed and how many are probable, and whether or not that sort of creates a larger headline than it would have 8 days ago if we went under the old math?
Well, I love that there are people who think there's some conspiracy to this. This is a CDC guideline that we're following. I'd like to turn it over to Dr. Ezike, if you don't mind, just to talk about why those numbers are combined. And I'm not sure if you know exactly what today's breakdown is, but that might be helpful as well. Thanks.
Okay, so we had 15,000. I don't have the numbers exactly, but I know of the 106,000 tests that were resulted over the last 24 hours, about 7,500 were antigen tests, and we can, and those antigen tests are in the probable, but all of those tests obviously were not positive, but about 14% of those, about 7,500, so someone can help me do that math, but it is not being, that 15,000 is not being driven by the antigen test. We just have a lot of disease. But it doesn't matter if it was antigen tests. Those are also COVID patients. And so I think we have to just get away from the idea that those are somehow half a COVID patient or less of a, I mean, they are COVID patients. They are individuals who are diagnosed with COVID, are going to be treated for COVID, and a percentage of those are going to go on to need hospitalization, and unfortunately, some of them are going to die. So whether you were diagnosed with the molecular test or the rapid antigen test, I don't think we want to get into parsing out how were you diagnosed. Those tests tell people who have COVID, and we're going to care for all of them the same.
Dr. Ezike, so the PCR, the molecular test, is much more reliable. And this is kind of goofy, but Elon Musk today took 4 antigen tests. 2 came back negative, 2 came back positive. The Chicago Bears one time, they had 9 false positives. Those were also the rapid saliva antigen test. Is there any way you could push back from the CDC and just say, can we separate those and not count those tests because they are not as reliable as the PCR?
So actually, if you want to get into the sensitivity and specificity, they're both tests are in the 90s, in the high 90s. So those are both good tests. Yes, there's always a gold standard test, and the PCR test is the gold standard. But just with many other screening tests that you can have, take a pregnancy test. You can have a blood test. You can have the one that you can get from the drugstore, even the dollar store, and you will still use that. And you know that that's going to give you a reliable result. Are there a few cases in which it won't be perfect? Yes, that's true, but that doesn't mean that you're going to throw away a positive pregnancy test and say that there's no way you could be pregnant. So I think people just need to wrap their arms around this test and understand it's a very good test. It's better than some of the other tests that have come out before it. I think the data, again, with anything that's new, you will have research papers and science and literature that will come and give you all of that additional data to support what we're saying now. But this is the CDC recommendation. We have a test that is good, that will give us accurate results. It helps us identify cases even sooner, which is so important when you're trying to have the people who are infected isolate as soon as possible instead of spreading it around in the interim while waiting, 2 days for the PCR result.
Can I just ask
And
a
if
follow-up, Dr.
sorry, go ahead.
Sorry, on the initial questions here. So if we were using the mathematics of 9 days ago, 8 days ago, where we did not combine, what would today's number be? Because I feel like people are used to an apples to apple, day-to-day.
14% of 7,000 is about 1,000.
Okay.
So it would be 1,000 less than 15,000, what are we, 500?
Yeah.
And Chris, I'll get you the exact breakdowns
Yeah.
from DPH. We have them.
I think
Yeah.
that, may I just say, though, I mean, there are people who are kind of promoting some sort of conspiracy here about it. And the truth is that, first of all, the federal government has distributed the new antigen test called Binax Now, which is produced by Abbott, actually here in Illinois, and it has a 90+%, I don't know what the exact number is, sensitivity. So it's very close to the PCR test, but yes, it's not quite. And that's why the CDC wanted to divide those numbers up. But it's not, literally, you're talking about roughly 1,000 tests, roughly 100,000 tests that are PCR and roughly 6,000 or 7,000 that are antigen at this point. So, this idea that we're piling on tests and trying to make it look, listen, nobody wants to have more positive tests showing up in the state of Illinois. What we do want to know, though, is if people are positive. And I'm talking about 90+ % of the people who are taking antigen test and getting tested positive are in fact positive. So, we're going to need to use saliva tests. We're going to need to use antigen tests. We're going to need to use PCR tests. Let me remind you that a PCR test takes about 3 to 4 hours to run the test. And, and some of these other tests like Binax Now, that's a 15-minute test. That's a huge benefit. To be able to test lots and lots of people in a very short period of time, that's a huge benefit. And so we're going to take advantage of the fact that the federal government sent us those tests.
So, Governor,
Eric. Craig.
to the point of the underlying question, which was, your reaction to these numbers today, regardless.
They're awful. They're awful. We are at a crisis level. I've said that for some time. If we're watching these numbers go up, there's got to be some personal responsibility that gets taken by not only people for wearing masks in their communities and asking their neighbors and friends who are not wearing masks to wear them, but also the local leaders, as I've said, who are taking no responsibility. And in fact, they're leading others to believe that, it's okay if you gather in big groups. It's okay if you have a concert in your bar. It's okay if people don't wear masks. And that's just wrong. That is the conspiracy that is working against the people of the state of Illinois.
In terms of the Chicago area specifically and non-ICU bed availability, I know according to the website, regions 7, 8, and 10 are now below 20%. In the first wave in the Chicago area, did it ever get below 20%? Where are we right now compared to the low point of the first wave as far as hospital beds?
So I've tried to make that distinction that in terms of the wave one, this wave two is really hitting in a different way. Regions 10 and 11, Cook County and Chicago specifically, really took the biggest hit. And so the numbers that they peaked at, they have not reached them yet. But Region 7 is at that peak already. Regions 1 through 6, they've already exceeded what they saw in wave one. So let's see, for Region 10 and 11, they may be just under 20%. We can get you those numbers. It's hard for me to memorize all of the numbers that I'm trying to keep on top of every day. But we are seeing capacity decrease everywhere. Because as you get this many cases, which translate into a certain amount of hospitalizations everywhere, I think you've seen all the numbers that have been put up, 100%, 200%, 300% increases depending on where you are. So everyone's capacity is being threatened. You've identified the ones that are the most imminent, but everyone is heading in the wrong direction. And so everyone's trying to make plans on how we're going to brace for that and be able to have care for not just the COVID patients, but if someone has a heart attack tomorrow, that person is also going to want to have a bed in a hospital. And whether it's a COVID person in that bed or a flu person in that bed, that heart attack victim needs to have some care too. And we need to make sure that going into these coming months, that everyone's going to have a bed to be cared for.
Any more discussion on perhaps limiting the elective procedures? I know I asked a few days ago.
All options on the table. Many hospitals have already gone to that. There are hospitals that have already shared that they've already started postponing some of the non-emergent procedures and surgeries because they had to, because they needed the staff, because their own staff have come down with COVID or are in quarantine or whatever the situation is. Staffing issues, you have to redirect some of the staff that would have been involved in the non-emergent procedures, to the inpatient care. So that is already happening. We are also going to share some guidelines around that. But again, we know that the hospitals will do what they need to do. It's going to be obvious if they don't have beds, if they don't have staff, that there's going to have to be some reconfiguring. And so we're going to partner with the hospitals to do just that.
That's happening in the Chicago area? Some of these hospitals you speak of that are taking these steps?
No, I haven't heard that in the Chicago area, but that has happened in other places across the state.
Dr. Zika, while you're still up there, can we ask you about the vaccine? Have there been any hospitals in Illinois identified yet, or are going to be the first to get this vaccine, and where do things stand with that?
Right. So the process, again, if you go to the website to see the plan that we submitted to the CDC think October 16th. We have, the process is explained there, but there is a pandemic provider enrollment. And so everyone who is going to be part of this COVID vaccine effort has to enroll and sign up and go through the training and accept to, prioritize the patients in the way that we're recommending to ensure equity and ensure the highest risk people and our first responders get it first. So when the vaccine is ready, it will go directly to the people that have been enrolled. So does that get to your question? It will ship directly.
But there's no hospitals in particular that are going to be prioritized necessarily.
Well, hospitals can enroll as well. So hospitals are amongst the groups that will enroll to receive vaccines. So hospitals, clinics, individual providers, everyone is enrolling, and then the, IDPH will be monitoring the, some of the allocations, but it will be direct shipped to each of those different locations.
All right, Governor Pritzker, can I-
Yes.
This will be the last question.
Okay.
Sure.
You mentioned that we have potential for bed shortages in the hospitals, but if you
Yeah.
talk to doctors at Rush and Northwestern and UC, they said, yes, there's more hospitalizations, but the patients aren't staying as long because of better therapeutics.
Yep.
And
Yep.
since we're testing, back in May and June, we were testing 20,000 people a day.
Yeah.
Now we test 106,000.
That's right.
564
Yeah, we're
just yesterday.
very fortunate,
So
yeah.
did you plan to prepare for this? Or
Yes.
You did plan?
I mean, look, you
I mean,
can't
you
prepare
figured
for, who knew where we would go in terms of the numbers, right? But I think everybody had a sense that there might be a second wave. For Illinois, it's a second wave. For many other places, it's a third wave. But I think everybody talked about, we all knew that the fall, because of flu season, could become a big second wave. And so lots of planning put in place for a second wave.
But we'll have enough beds for Illinois.
Well, I can't guarantee that for sure. I mean, nobody, it depends. Are people going to follow the mitigations? Are people going to enforce the mitigations and so on? No, that's not a guarantee. There's no guarantee. I think I will say that Dr. Ezike and I both talked to hospital leaders. For me, anyway, it's been every day over the last several. And very regularly, and Dr. Ezike probably every day is talking to at least one, if not multiple, hospital leaders. So, we're checking on their availability. They need to control their own beds and tell us how they can change their system so that they can handle more COVID patients as they come in. And also, as Dr. Ezike said, the definition of an elective surgery is a pretty broad one, right? You can have something that's an elective surgery that you really don't need to have. It could be plastic surgery for, for something that doesn't really need to happen this year. And it also could be, in the definition of an elective surgery, something that is, a knee replacement, but without it, your knee is deteriorating every day. And so that's very, very challenging. And so we want doctors and hospitals to help make those decisions, and they are, and they're doing a reasonably good job of it right now. But as more and more COVID cases show up, we need to make sure, at least as a state, we're the last resort here. We want to make sure that everybody has a hospital bed if they need one. And so we're working with all the hospitals to make sure that their patients are being managed properly. If there aren't enough beds at one particular hospital, for example, if that happens, we want to make sure that they can be that a patient can be transferred to another hospital.
All right, this
Governor,
we have to go online.
Can I ask
Okay.
one question on unemployment? Would you mind?
Sure, go ahead.
Governor, you repeatedly blame the federal government for the widespread fraud happening now
PUA,
in the
yeah.
Illinois unemployment system. But we've obtained internal weekly reports sent to IDES by the company that built and maintains the PUA system, which reveals IDES is struggling with identity verification that leads to fraud. 44% apparently of unpaid claims are being held up because of it.
Yep.
Other states, including California and Kansas, have taken a much more proactive approach. What more should Illinois be doing to be responsive to the tens of thousands in Illinois who've been victimized by
Well, they are doing identity matching so that we can make sure and ensure that, that is exactly right, by the way. People are stealing other people's identities. They're going into the dark web, they're getting people's identities. They're waiting, by the way, these identities have been stolen perhaps years ago or a year ago or 6 months ago, right? And they've been waiting. And then they file it because the person whose identity has been stolen, they want them to just continue on believing that they're safe. And so then they get, these attacks come, right, where there are multiple applications that are put in, from a group of people all at once. That's why you've seen some spikes. They seem to come in waves, these fraudulent claims. But no, Illinois is very much doing this kind of identity matching that other states are doing too. Just because we have a fraudulent claim that comes in doesn't mean it gets paid. And so it's very hard to stop somebody from filing a claim. It is, they can file a claim. It's on us and on the investigators, the federal government, the state government, to try to identify the fraudulent claims before they actually go through the process of being paid out.
Okay, we got to start online.
They
Question?
are in that process now, yes.
enough as a state?
Illinois is doing that, but like I said, you can't stop people from applying. You know.
Charlie Meyerson at ChicagoPublicSquare.com. What's your top pandemic-related wish list item for President-elect Biden and his coronavirus team?
Wow. Well, I've already been in touch with people who are involved in that COVID-19 task force. And there are a number of things that we need in Illinois. It's no longer so much about things like PPE, because I think we've been able to get the supply chain moving in a way that allows us to fill up our storehouses. It is very much now about providing some standard for the country, a strategy that doesn't mean that if Iowa has a 50% positivity rate and all the states around us have different positivity rates, that Illinois is going to be next. That's the situation that we have now. And again, it's not all to blame people around us, but let's face it, if you don't have a standard, that other states around us, some of them have no mandates. They have no mitigations in place, either because they were thrown out by the local courts there, or because the governors have chosen not to impose them. And so we need to have national standards and national strategies around this, and in particular, a national mask mandate.
Dan Petrella at the Tribune. 2 weeks ago, you projected regions 3 and 6 could have hospital bed shortages in as little as 2 to 4 weeks. Can you provide an update for all regions, and when will you release the detailed models used to make those projections?
So I think we put our hospital data up how often does it get updated? Every day. Every day we update the hospitalization data, and we rely on a variety of models to determine, and we make judgments about the variety of models to determine where we ought to land in terms of our belief of how many weeks are there going forward. By the way, you have to add to that the real-world experience of talking to the hospitals themselves.
Jim Leach at WMAY. Any reaction to Senator-elect Bailey's tweet today encouraging businesses to stay open because he says you don't have the authority to do what you've been doing?
Well, Senator Bailey has been putting out falsehoods since the very beginning of this pandemic. Talk about a guy who purveys conspiracy theories. He's lost every case now. He had one case in Clay County, a friendly judge local to him who ruled one way. Those cases have all been tossed out. And so I don't know. All I can say is, he's part of that, set of people out there who like to purvey lots of falsehoods and conspiracy theories.
Mike Flannery at Fox. Senator Tammy Duckworth just told CNN she'd look long and hard at a job offer from President-elect Biden. If she accepts one, who would you appoint to the U.S. Senate?
Boy, that
You
is
just
highly
wanna-
speculative.
You just want to throw that out there right now?
By the way, there are reporters here pointing at each other who would like the job, apparently. So, yeah, no, I have no idea. But I will say that Tammy Duckworth is a terrific person, a real American hero, and somebody who's been highly effective in her job as U.S. Senator. I would hate to lose her as a U.S. Senator, but gaining her on the national level would be a benefit to the entire country.
Alex Fisher, at what point will the state stand up McCormick Place or other alternate care facilities again? Why was McCormick Place shut down?
Well, we didn't need McCormick Place since essentially, and since we saw the numbers coming way down in May and June. So look, anything is possible, I suppose, but we're not looking now at McCormick Place as something that we would need. I say that, but not knowing what the future will look like, but we do have alternate care sites that we are prepared to use if we need to.
Governor, can I follow up with that? Because there's some who've looked at the numbers that came out regarding McCormick Place.
Yeah.
81 million to set it up, 15 million from the state to staff it, treated 38 patients.
Yeah.
Was McCormick a waste of money, a waste of time?
Well, you know, I want to remind you, Craig, that nobody knew where this virus is going, right? What the numbers would end up being. All we could see at the time was the numbers are going straight up, and we didn't have any idea really how to abate it. In fact, so much so that at the time, we really all had to take very, very significant measures, that some of which we didn't know if they would work, because it's truly a novel new coronavirus. So at the time, we wanted to make sure that nobody was going to be without a hospital bed. And so we prepared not only with hospital beds, but also staffing at alternate care facilities really across the state. It wasn't just about McCormick Place. Because we just didn't know. And I guess we still don't know, but we know more now. And certainly early on in this pandemic, the issue, the focus should not have been on, what does it cost to keep people alive? It should have been on whether or not we could keep people alive. And that was really what we were focused on early on.
Thanks for watching. And if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.